Hello, everyone. Thank you for your patience. My name is Nick Webster. I am the Key Accounts Coordinator for Fear Free, and I'll be your webinar host for this evening. Thank you for joining us for Successful Medication Strategies in a Fear-Free World, brought to you by our friends at Covetrus. Presenting today will be Dr. Sharon Minninger. She is a small animal veterinarian practicing in southeastern Pennsylvania. Dr. Minninger founded and owns Telford Veterinary Hospital. Additionally, she provides operational veterinary oversight as the team veterinarian for a regional canine search and rescue team and serves as a partner and consultant with veterinary business builders. She has spoken nationally on a variety of veterinary topics, serves on numerous veterinary advisory boards, and consults industry partners on best practices with a focus on emerging medicine and technologies. Dr. Minninger obtained her undergraduate degree from Delaware Valley University and completed veterinary school at University of Tennessee. She has spent over a decade volunteering with therapy dogs in the local special needs community, where her therapy dingo named Heidi reached local celebrity status after having a children's book written about her therapy work. When she is not in practice, she enjoys gardening, hiking outdoors, and traveling with her husband, as well as their 2 dogs. We're so excited to have Dr. Minninger here with us. So on that note, I'll pass it over to you and we'll get started.
Hey, everybody. Thanks for taking time out of our busy veterinary lives to join me tonight. We're going to talk about successful medication strategies in a fear-free world. And I think many of us, all of us, are lucky to be doing fear-free medicine now for a number of years. We're going to hope and improve some of our medication strategies and some techniques for animals going forward. So again, great introduction. I am Dr. Minninger. I am a consultant with Veterinary Business Builders. I am a small practice owner, like they mentioned in the orientation, and I am a proud fear-free certified professional, level 3, hoping to become elite next year. That's my goal anyway. And I am a proud mom of 2 Belgian taverns. They'll come up in the presentation a little bit later as well. I also want to take a quick minute just to thank Covetrus for continuing to support the veterinary industry, and especially fear-free as we move to improve FAS and, improve the lives of the animals that we work with so closely every day. As we get started here tonight, just real quick rundown of what to expect and what to get ready for. We're going to introduce the problem at hand, which is medicating animals. We deal with that all day, every day. We're going to understand exactly how the struggle impacts everyone from the pet to the owners to ourselves in the veterinary hospitals. We've got some great creative solutions for you guys to put into practice tomorrow morning when you go in, if you're so inclined. And then I'm going to round out with some case studies, some things we've actually done in our practice that have made a measurable difference and really helped the lives of our pets and their pet parents. We're going to use some tips for training all of those people involved and the animals for success. So what if we changed sort of the trajectory of medicating animals? And then we're going to tie up with some questions here at the end and hope you get a lot out of this. So where are we now? How historically have we treated medicating, right? Let's look at the problem at hand. Well, it starts with our wonderful little 4-legged friends. And dogs and cats started as farm dogs and barn cats, right? They were outside, they had an important job to do. They protected the property, the farm animals. Cats kept critters down in the barn so that they wouldn't get into the feed. They had an important job. And as that relationship matured, eventually these great little critters became domesticated house pets. I think that's about the time I became a veterinarian. And I am proud to say I am the proud pet parent of 2 4-legged children. I have fur babies. And again, we've progressed from barn animals and outside animals to domesticated animals and 4-legged fur babies. But in doing that, we've actually created a small problem here. And this is what we've done. We have accidentally found great creative ways to increase FAS, right? And we're all aware of this. We're all aware of the fact that we now bring them in our beds and they sleep with us and cuddle with us. And we've generated things that allow them to have more fear in life and not necessarily prepared them for what they might face. We've gotten really good at negative reinforcement, especially for important points in their lives, whether it's medicating or training. And we're slowly working to undo all of that. Inadvertently through all of this, we've eroded that human-animal bond, which is so important to all of us at our core and at our root. So what we're going to do tonight is we're going to give you some solutions. just by raising the awareness of some of the, I don't want to say mistakes, but some of the trends we've done over our careers, we're going to raise awareness so that we can see these situations develop and hopefully prevent them. We're going to get good tools in our toolboxes to decrease FAS during medication through an entire lifespan of an animal. We're going to get improved compliance by our owners because of this. We're going to use positive reinforcement training all the way, just like Fair Free has taught us. And in the end, the outcome we're all looking for, strengthening of the human-animal bond. So let's look at this struggle a little closer, right? We have pets, owners, and medications, and the end result of that whole thing is generally increased FAS. So let's look at it. Here's your little boxer puppy. You just picked him up from, well, you don't go to pet stores anymore, right? You rescued him from a shelter because he was in a distraught part of the country, and you bring this little critter home. And the first thing he's thinking is, they love me so much. I'm in such a great place now. I get so many hugs. Then you have your first vet visit, you get home with him, and he's trying to figure out, why are you suddenly chasing me with pills? Doesn't make any sense. Didn't seem like how our relationship got started. And then take the cat's perspective, right? The feline queen. We've taken her out of the barn. We've brought her in the house. She probably has a heated perch on the windowsill where the sun comes in at just the right angle, and it lights up the bird feeder outside so she can watch the birds as they're feeding. And she's thinking, these wonderful people have given me everything I need to live my best cat life. They're amazing. And right after she gets home from the vet, she's trying to figure out, why are these people touching me again? And what crazy idea do they have trying to open up my mouth? And then we've got the pet owner, right? An integral part of this whole relationship. And they come in and they say, I love you so much, my little feline queen and my little puppy. You need these medicines to stay alive. The vet told me so. And then they start questioning us. The vet said this was going to be easy, but how did we equip them for this to actually be easy for their little fur babies? So let's dive a little deeper into the problem. Let's look at dogs first. Why do dogs struggle with medication? There's a lot of reasons, right? Let's just start with breeds. We medicate everything on the dog spectrum from Chihuahuas to Great Danes. Right there's a lot of problem. Chihuahuas, well, they have a reputation. They could be a little snappy or a little nippy. We need to get a little bit of medication, a bit of a pill into a relatively small dog who might be a little more assertive than he would need to be in that relationship. And then we've got the Great Dane who's submissive as anything, but now we might have to get a large volume of medication into that dog. And so the size and the nature of the breeds that we deal with presents some of the problems we have with medicating. Take into consideration then touching and handling an animal. We know from our fear-free training, the paws of the pads have extensive amount of nerve receptors, way more than you and I would have. And so just that whole handling concept can be more painful or more stimulating to an animal when we're trying to do a treatment. And then medication, right? Medicine in general, as a general rule, tends to be bitter. Palatability is not something that necessarily we equate with medication. And then let's look at cats. I ask you to think about this for a second. Why do cats struggle with medication? And perhaps it's really people are the number one reason why cats struggle. I actually think if we sat down and thought about this and talked this out, most of the behaviors we associate with cats and medicine are learned rather than innate behaviors, okay? Think about that. That owner comes home from the vet hospital with that cat that was sitting on her royal throne to give her medicine. And what's the first thing we do? We start chasing her. Well, go back a step. We chased her to get her in the carrier to bring her to the vet in the first place. We get her home with medication to give. Now we start chasing her again. Is the cat truly an elusive and reclusive animal? Or have we generated that by all this chasing and trying to catch them? What if we train cats to come when we call them, just like we do with dogs? Maybe we could counter that elusive, reclusive behavior. Restraint, same, challenges that we deal with in dogs, we can certainly expect to deal with in cats. Have we made touch and petting a good cooperative situation for them? And are cats truly finicky in particular about, treats and food? Do they have food aversion, so to speak? Or have we found that the cat likes salmon and we don't necessarily give them a lot of options, and we've made them, finicky in particular because we find something they like and we stick with it, rather than giving them variety like we might be more inclined to do with dogs. And then our owners. Owners have an awful lot of reasons to struggle with medication. I hit some of the key ones here, but think about it from an owner's perspective. Prior bad experiences, right? Whether it's them taking medicine as a kid, up to them potentially having medicated animals in the past before the actual interaction you're having with them that night. Maybe they were injured. Maybe they got, bitten by their cat trying to get medication in. Maybe they went home with medicine and figured they'd check in with Dr. Google on how best to pill a cat. Can you imagine the wormhole you'd end up in if you actually Googled, as a lay person, medicating a cat and the horror stories you could find? They now have no interest in trying to get medication into their dog or cat for that matter. On top of that, we're emotional beings. We know the pet doesn't feel well. We know or assume meds don't taste good. So why are we going to actively be excited about trying to medicate a sick animal when we just consulted Dr. Google? Next thing is bad pets. And I know Fairfree might have taught us that there's not really any such thing as a bad pet, but I'm going to give the perfect stereotype with my two dogs. You saw them at the beginning. I have two. So by nature, I'm going to have a good dog and a bad dog, right? So even if Mervin isn't truly a really bad dog, in my estimation, he's not as good as my good dog. So that must make him my bad dog. Owners are going to do the same thing, right? So we go in with a perception that we may already have a bad dog. And Merv might be perceived as bad because he's a little more aggressive than my other dog. And he certainly struggles a little bit more with anxiety than my other dog. And so Merv is a bad dog in my estimation, even just as an owner. So now I want to medicate a bad dog who doesn't feel well with bad medicine. I don't stand a chance, right? And then add the compliance factor in. And I'm not telling you guys anything you don't know. Owners have to remember to order medicine, have to pick it up, have to remember they're going to run out tomorrow or the day before tomorrow, or with any luck, a week before they're running out. Then they have to administer it. Then they actually have to follow the directions. How frustrating, and how many times we have somebody come in for a recheck, do they realize they didn't follow the label directions because they thought they remembered what you told them, but they never actually bothered to read the directions. So owners are at a huge disadvantage when it comes to medicating successfully. And so when we look at this problem, we look at this struggle, I've got a little equation that I think is going to help make this more applicable and more manageable for all of us on a daily basis. And so if we look at any situation and we combine the situation at hand, the thoughts we go into it, the emotions that situation drives in our actual core bodies, and what outcome we end up with. I know this feels like a lot, but bear with me a second, because I think if we look at medicating where we're at right now, and the outcome of poorly medicated animals, we're doing the same thing. Every day we have a sick animal come into the hospital. Every day we prescribe a medication. Every day they go home with it. And every day we're surprised that maybe it didn't have the outcome we were expecting because they weren't compliant. I think Albert Einstein actually states that the best. The definition of insanity is doing the same thing over and over again, expecting different results. I'm hoping after tonight, we can change that statement. I know it's late, well, at least if you're on the East Coast with me, it's a little late for a meeting tonight. So I'm going to dummy this equation down. We're going to go to third grade, quite frankly, for some of us overachievers. Maybe this was a first grade math equation, right? So if I want a desired outcome and I have a situation, I have thoughts, and I have emotions, my outcome is 3. But what if I don't want my outcome to be 3? What if I want it to be something different? Maybe I want it to be better than what we're currently dealing with. And so if we look at that, and I now need my outcome to be 5, perhaps I have to put different inputs in to get to that outcome. Let me make this a fear-free equation, right? We're fear-free certified clinicians and practices, and fear-free, this is what fear-free has taught us over the last several years. We're used to having, or prior to fear-free, right? Prior to 2016, we had reactive pet exams. You all remember those. They're not that far along in our past. What was your concern at that point? The animal came in. Are they going to bite me, the veterinarian? Are they going to bite my team? That won't be good for the rest of the day. Or heaven forbid, are they actually even going to bite the owner? If they bite the owner, where does that take things? Now, what kind of issues am I dealing with? So our emotions going to exams prior to fear-free, we, the clinicians in a reactive pet exam, were stressed. We were concerned. We were anxious. I'm sure you guys recognize we transfer that to the owners, and we absolutely help to transfer that and make the situation worse for the pet. What was our outcome? That's when, as clinicians, we adopted the brief exam because we felt that's all we could safely perform without anybody ending up at the hospital. And we ended up with forced vaccines. We're pretty sure they got enough rabies in for it to qualify as a vaccination, but we can't swear to that, right? What has Fear-Free shown us? We're able to now do complete exams with effortless vaccines. That's our fear-free goal, right? And how did we get there? We put different things in the situation. We uptrained for it. We now can practice with a fear-free visit and a full examination. How do we do that? With training. What's your thought now as a fear-free clinician going into that exam room, maybe with a reactive pet? We've trained for this. We're prepared for this. If plan A doesn't work, I have a plan B and a plan C in place. If that doesn't work, I can pre-med the animal more. I can have a deep conversation with the owner, and I'm going to go into this calm and unruffled. I'm relieved because I now have a whole toolbox full of options to give an owner. And I do successfully complete all day, every day, complete exams with effortless vaccinations. The biggest complaint we have now is owners saying, when are you going to give the vaccines? When we've been done for several minutes and the pet's been eating treats the whole time. So now work with me here. Let's make this a medication equation, okay? Here's what happens all day, every day in our hospitals. We have pets that need medication. We know we should do this. We know we should get owners to do this. We know it's probably not convenient for them, whether it's once a day or 3 times a day. They have busy lives. We know it's not necessarily going to be easy, even though we're trying to advocate that it will be. And so what emotions do we have? We're concerned. We're anxious. Is that animal going to get successfully treated? Are we going to have a positive outcome? And where do we end up? This is the dog that comes in with the skin infection. You're sending him home with antibiotics that he's going to take once or twice a day, maybe some anti-inflammatories, some pain medicines because he's uncomfortable. And what do you expect of that recheck? Honestly, they come back in. We now know, have them bring their pill bottles. There's still more pills than they should have in there. We have a compliance failure. And now we have successfully had an owner spend 2 weeks trying to get medications in inappropriately and creating bad experiences twice a day for the last 2 weeks. How are we going to rectify this? How are we going to make this right? That's where we come in tonight. That's what the moral of tonight is, to get us some creative solutions. Let's work on changing the equation to achieve best outcomes. With that, let's do a little reflection. Human medicine, what works? I'm not going to ask for a show of hands. Please do not hit up the chat because I don't really want to know. But how many of you ever seen a pill gun used on a child? Why is that? Why don't we hold a child down and take a pill gun and get the pill down their throat the first time, every time? Well, because that's not appropriate. And so why is that appropriate for our fur babies? What works for kids? Gummies, right? Now they make, when we were little, we were lucky if we got Flintstones chewable vitamins. Now they have gummy vitamins. Kids line up to take those, right? Lollipops. Where do we see lollipops used for medicating children? We see them in the hospitals all the time now, right? They put pre-anesthetics, sometimes even anesthetics in the lollipops. Think about that for a second. Where do you think that technology would be, or that medication deliverance system came from? I know when I was a kid and we went to the doctor and you got your vaccine in your arm, you got a Band-Aid over your vaccine site and you got a lollipop to go home with. Why? Because you were a good kid for your vaccine and you were excited to get the lollipop. Don't you think that was part of the theory behind kids know lollipops are for being good at the doctor? So now if I'm in the hospital and I'm ill and I need a sedative and they put in a lollipop because I'm a good kid at the doctor, I'm going to take that thing right away because I know I'm a good kid at the doctor. And now all of a sudden I get my sedative on board and I'm doing great. Flavored liquids. Do you think it's an accident that amoxicillin is bubblegum flavored? Probably not. But that's how we get it into children. How can we apply some of those things going forward? And we'll give you lots of examples. What works for adults? Transdermals, right? Nicotine patches. Why do we do a transdermal nicotine patch? Because it's there every day, all the time. I don't have to forget about it. And if I'm going to quit the habit of cigarette smoking and I don't have to rely on taking something every day, there's a whole lot more chance of me being successful. We talked about how gummies work for kids. Gummies work for adults too. Fortunately, this presentation I'm doing in my little studio office, as opposed to upstairs in my bathroom, and you're seeing my bathroom, sink area. My husband's got his multivitamins in gummy form. And because that works so well for him, he actually has melatonin for the nights he can't sleep. That's in a gummy form right in my bathroom. Forms that are tasty are more likely to be taken and not thought of as a medicine. Extended release tablets. Why do we use those for a lot of our antacids in people? Because that way the medicine's there again 24/7 and we don't have to take it multiple times a day. Quick dissolve, a great invention for people that might have a phobia or difficulty swallowing or getting medication down. Another great solution that we have in people that works great. And then let's think real quickly for a second about the non-medicinal solutions we have to make us feel better. Behavioral science sort of to make us feel better. Chicken soup. How many of you go out to your favorite restaurant and order chicken soup when you go out for dinner? Probably almost no one, right? Because chicken soup is for sitting at home on the couch with mom taking care of you, the blanket wrapped around you and the fireplace on. That's what chicken soup is for. It makes you feel good when you're sick. What if we use something along those same lines for animals when they were ill, right? I would say in people, the same thing with ginger ale. Not everybody's favorite soda, but it's great when you have an upset stomach, just like saltine crackers are. What if we thought about this a little bit deeper? What if we started with our pet friends and on nights you order out Chinese, you take a little bit of the plain rice, not the pork fried stuff, but the plain white rice, and Chinese night became a night to sample with your dogs or cats a little bit of a bland diet. And they equate Chinese food with that love and care that you think of with chicken soup and mom and the warm blanket. And now all of a sudden they're excited for Chinese night. So now when the dog has blowout diarrhea and you need a bland diet, maybe you order out Chinese to take care of the dog who's not feeling good. And he gets a little bit of that rice with his dinner to help his diarrhea. And maybe he looks forward to Chinese nights, and that can be his special thing when he's not feeling good. Let's look at veterinary medicine. We have some things that work really well. How many of you dread the insulin conversation with owners? Probably not. It's one of the things I actually really enjoy. I know my technicians enjoy it. We have an opportunity to take an owner who probably has some degree of needle or injection phobia of themselves. We teach them in the course of 45 minutes to an hour how to safely and correctly draw up medications, administer an injection that they're not going to do twice a day for the rest of their pet's life. Maybe that's 5-10 years, and they're going to do that successfully. And when they go to do that, the animal's going to come running for the shot and sit there and wait for it. Why? Because insulin injections are the best case of positive reinforcement that we've ever done in veterinary medicine. What do? We give love and hugs and kisses and praise to the animal for coming to us. We give them whatever their favorite food is so that we know that they're going to eat. And all of a sudden, we positively reinforced and trained for success with insulin. People, if we can do that for insulin injections, there's no reason we can't do that for everything. We just have to rethink how we're going to train the owners to do this. Let's talk about other things that are successful. Pill pockets, liverwurst, cheese. All of those things are great instruments to hide treats. They're treats that we can hide medications into, right? I know in my household, I've taught both of my dogs as they were growing up as puppies, the rattle of that pill pocket bag, that little sort of foily type bag, I can crinkle that anywhere and they will come running from anywhere possible to come back knowing there's a high value treat at the end of that crinkly bag. My dogs think if a bag's crinkling, even if they're vomiting and need something to settle their stomach, they know the crinkly bag is the best thing I got going in the house. And they come running, waiting to get that treat to accidentally fix their nausea and vomiting. And then let's look at another example. Let me throw this out. My associate has actually 2 puppies right now. Whole nother story, not highly recommended, but she's managing 2 special needs puppies at the same time. And what she's actually done with her dogs, knowing that they're going to have lifetimes of medication, is she's normalized pill pockets and cheese cubes in the dog's food. And so every night when these dogs are getting fed their dinner, they get a little piece of a pill pocket or a little cube of cheese in their dinner. Not enough that it's a crazy amount that it's going to cause digestive issues, but enough that it's normal for them to eat that out of their food dish. She set up when those dogs ever do become sick or ill or need medications or chronic medications for joint problems that they'll develop, they already know that's just part of being a dog. You get a little pill pocket and a cube of cheese in your dinner. So when one happens to be laced with a little medicine, oh, well, that's just how it tasted tonight, right? The other thing that works great in veterinary medicine is Bordetella vaccines. Why do oral Bordetella vaccines work so great for us? Because honestly, the other forms didn't, right? Injections. When I started, that's what we had. We had injectable Bordetella. It was great, except the efficacy wasn't there. And when they showed us through intranasal vaccines, we could really improve efficacy, we all switched to intranasal vaccines. Only that was real fear-free, right? So now the dog that doesn't want something shoved up their nose, because I don't know, that doesn't make sense, right? We would then muzzle the dog, hold him down, pin him down, put the intranasal vaccine up his nose. We single-handedly did more to increase FAS for dogs coming to the hospital with intranasal vaccines. Fast forward, now we're fear-free. Now somebody decided, hey, we can still get great efficacy if we put that vaccine in oral administration, and they'll probably get all of it, or at least all of it. And so now in my hospital, hopefully as in yours, we take those oral Bordetella vaccines, put little squeezy cheese toppers on them, and I'll get families with multiple dogs, and the dogs are actually fighting over who's going to get the Bordetella vaccine, because again, it's such a win and such a success. So how can we apply some of these things? Let's start by thinking outside of the pill, right? If the pill is the problem, what other options do we have? We have transdermal medications. Those are great. We've been using them in clinic for years, but do we use them to the full extent of what we can? Why are they great? Metered dose. We don't have to worry about an owner, at least easily, overdosing, multiple dosing, repeat dosing. It's a metered dose. It's absorbed. It's not eaten by the animal. It's not administered inappropriately. We have direct dermal absorption with great efficacy for most of our products. And there's minimal stress involved in doing that. Let's think through this a little further. Now we have any of the animals that come in with dental disease, dental problems. At 4 o'clock tonight, I actually had a cat in the office that presented for not eating well. He has a cancer of his lower mandible. That cat's going to get transdermal medications. We're not going to try and put something in his mouth to try and manage his pain. It's just not even humane. So transdermals are a great way to think outside the pill. How about flavored liquids, right? They work in people, they work in kids. Maybe bubble gum isn't the choice of every dog and cat that comes in the hospital, but there's dozens and dozens of different flavors we can use for flavored liquids. I'm going to show you a case study where actually a flavored liquid was the answer to this dog's problem and not even something I had considered. So we'll show you some options where we can use that. And if we've got flavored liquids, we can make flavored chews, right? We can make a medication that a dog is going to need to take chronically into a high value treat. Let me give you a great example of this. I have an owner that's was in this week. We saw the dog for a 6 months recheck. We diagnosed it with early onset hip dysplasia. The dog was having some pain. We wanted to get it on a joint supplement. We went with a flavored joint supplement. The owner realized the dog doesn't actually like the flavoring of the joint supplement. But lo and behold, her second dog in the house does. And so for that first week or two, both dogs got the flavored joint supplement. Once she conditioned through a little peer pressure, the dog who needed the medicine to start taking it regularly, she stopped giving the joint supplement to the dog that didn't need medicine. That dog gets a milk bone, and the dog with the joint disease is actually taking his flavored, chewy, joint supplement, and he's doing great with it. 6 months later, not showing any signs of favoring his limbs at all. So flavored chews and flavored treats as a medication form is a great option for a lot of long-term medications. Other things we have, quick dissolve tablets. In doing this lecture tonight, I know of a couple products that are made as quick dissolves. There's actually a huge list, if you go home and research it, of medications. I'm especially thinking of our feline friends here, because if you can get it into their mouth and it dissolves instantaneously, we don't really have to pill the animal with it, right? So there's lots of actually behavioral drugs. There's lots of actually heart medications that can be formulated into quick dissolve tablets. And again, whether for Chihuahuas, Great Danes, or our cat friends, that might be a novel method of getting medication into them. Flex tabs. These are one of my favorite. This is where the pill on one side is a whole pill with a full milligram dosage. And my favorite example of this is with pimabendin. We've actually moved exclusively using flex tabs for pimabendin dosing in our hospital because of the ease of administration and the ease of dosage incremental increases if needed. So on one side, we have a 7.5 milligram tablet if we give the whole pill. If I flip it over in half, I have 3.75 milligrams, and in thirds, it's a 2.5 milligram tablet. Conveniently, that's exactly the right size for most of our small breed dogs. And so if that dog needs to continue medication lifelong, which for pimabendin, we're hoping they're on it for a long time, but his dosage might increase over time. Hey, if I can give an owner a medication that I can increase the dosage amount with a minuscule change in how they administer it, but they already have the medicine on hand. They're not worried about losing medication or expense from going from one, milligram to another milligram. It's all in that one pill, and we can explain that when they get it. That is a huge way to increase compliance. So think about flex tabs for flexible dosing, exactly like it's stated. And then last but not least, when we're thinking outside the pill, think about combination therapies. I don't know how many of you use these already in practice. I'm going to give you a couple examples of where we use them, but there are great clinical pharmacologists that are able to come up with and compound medications that we use on a regular basis in combination with each other. So instead of prescribing 1 or 2 or 3 medicines for some of our cardiac patients, we can prescribe 1 dose. And maybe that's in a flavored, choice of theirs. Maybe it's a liquid, maybe it's a chew tab, maybe it's delivered in a form that's actually tasty, but it's only 1 instead of 3. That's going to improve the situation for everybody. Owner, animal, they've only got to take 1 medicine. What a great option for them. So let's revisit this equation real quick, right? We have that pet that needs medicine. We know we should do this, so on and so forth. We end up with compliance failures and bad experiences. But what if our end goal is compliance? I'm pushing for 100% compliance and a positive experience, right? We don't have 2 weeks of negative training and negative reinforcement and bad experience. What if that's our goal? What are we going to put into this? Well, now we have a pet that needs medication options, right? He needs a medicine that's easy to give, easy to prescribe, and easy to continue for the lifetime and duration of that prescription, whatever that may be. What are our thoughts as the clinicians going into this? I now have something very special for you, the owner, and you, the pet. I know we're going to make this easy because you and I have talked about this. We know your pet's likes and dislikes. We know your training. We know what we've built up to get to this point where he's going to need medication, potentially lifelong. And how do we feel? As clinicians, we feel empowered. We feel confident. And if we're empowered and confident because we got the right medicine for the right animal and the right dosing strategies for the owner, we know we can get owner buy-in. And if it tastes good, we can get pet buy-in. And all of a sudden, if everybody's bought in and everybody's on the same page, we're going to see a whole lot more move in compliance and positive experiences with medication. So let's look at some case studies, right? This all sounds wonderful. These are case studies straight out of our hospital. In fact, the pets' names aren't even changed to protect their identity. So let's give you case number 1. I know these animals are all in your hospital, but so I hope this rings true to you. This is Roscoe. He is currently 16 years old and he's a little Chihuahua mix. These little guys live forever. Prior to Fear Free, we would have labeled him as a little land shark. He is a land shark, but again, I think we did a lot of that, right? Because he didn't start with congestive heart failure as a little puppy. He started that with as a senior dog, and he learned to teach his owners that he didn't want to be fussed with, and he didn't want to be handled, and he didn't want his mouth touched, and he didn't want his teeth brushed and all that. So he's difficult for them to administer medication to, but we need to, or our goal is to manage his congestive heart failure. So this is a great example where we're able to do a combination therapy and compound a combination of benazepril and furosemide into a soft chew. Well, Roscoe likes his soft chews, right? He likes his little meaty bone type snacks. He thinks that's delightful. He doesn't know he's getting medicine. And where we did end up with the medicine was on the pimabendin flex tabs. But again, we've got that 2.5 milligram tablet and a third of a pill. And Roscoe just slurps that down to get his high value benazepril treat to get his medicine in. We set them both up on auto ship, so the owner doesn't have to worry about running out, falling behind, not having enough medication, remembering to reorder it. So we've eliminated those things. And now we've got Roscoe at 16 with congestive heart failure, and he's doing great. Tilly is my case. As clinicians, we're not probably supposed to have a favorite animal, but we all do. And for me, that's Tilly. Tilly started as a Great Dane puppy with huge bouts of GI distress and was medicated from the time she was a baby for GI problems and a frequent flyer at the vet hospital, but she's near and dear to my heart. Tilly is currently 10 years old. And Tilly, like every good giant breed dog that was spayed, probably before she was a year old, developed urinary incontinence later in life. And as Tilly developed urinary incontinence, we started her on Proen. Proen was working great until one day, who knows what happened? She's a Great Dane. Perhaps it was a car backfired the day that the owner pulled the pills out to give them to her. But Tilly stopped point blank, would never take another Proen tablet again. And now we have 110 pounds of bladder leakage. Tilly was relinquished to sleeping in the stall shower. She was getting a full body hose down every morning for her urinary incontinence. And her owners actually came to me considering euthanasia because they didn't know what to do. Quite frankly, I didn't have a great option. And that's when I reached out to our pharmacist and I said, I need an option for Tilly. We learned Tilly liked having gravy put on her food every night. So we were able to have Proen compounded into a bacon flavored liquid. Tilly didn't know the difference. Maybe her gravy was bacon flavored instead of beef flavored. Tilly loved it, started taking her Proen again, incontinence cured again, and Tilly's doing great. And I still have my best friend coming to the hospital on a regular basis. And then there's little Grace. The interesting thing about Grace isn't that she's 16 years old. It's not that she has a seizure disorder. It's not that she has congestive heart failure as well. It's her owner. This is Albert Kohler, and that's actually his real name. Albert's special, and he probably comes to your practice. Albert is 93 years old. He's about 6'3". Albert's hands are twice the size of mine and incredibly arthritic. Albert cannot open even a non-child-proof cap on a pill bottle, nor can he pull out a tiny little piece of a gabapentin or even a tiny little piece of pimabendin to get it in Grace. And did I mention Grace is wonderful for us, but she actually bites Albert. And so he was distraught. This is all he has left in the world. We were able to show him that he could use a transdermal pen. He can click a pen so he can safely administer her medicine. He puts it on our ears. And now we've actually treated Mr. Kohler, and now he's able to treat his little dog, Grace. It's a huge success story. Look for places where you can treat the owner and you can manage the care of that animal a little bit better. And then there's this one. This seems like a completely routine case, except that this cat was referred into us because we were a fear-free hospital. And apparently there are still veterinarians out there, and I'm letting you know in case you're one of them, you don't have to tell anybody, that methimazole comes as a transdermal medication. And so this cat had been a barn cat prior to being brought into the house by the owners, still rules the house like a barn cat, doesn't want to be handled, doesn't want to be messed with. They were super excited because their vet had told them there was no way they could medicate the cat. They're on blood thinners, can't handle the cat cuts and scratches and bites from Tiger trying to medicate him. We put him on transdermal methimazole. He's perfectly regulated. Coincidentally, not really, I guess. Now we see all of their 5 animals total for their household, and we're their hero for fixing and getting Tiger back to good health. As we go through all these cases, I'm hoping that somebody's picked out the common thread between all of these. The youngest animals I have in here are 10. This is purely accidental. I didn't set out to do this. And the oldest animals I have in here are 16. What's important about this? We didn't start medicating these animals for chronic diseases when they were puppies and kittens. But what if we had? What if we had trained them from puppies and kittens, knowing they would be adult, older, and even senior animals that will need chronic medications in some form or other for some disease process or other? And what if we train our animals and train our owners for success? So here we go. Let's train for success. And let's look at this and how we can change these situations to get that desired outcome of successful medication. Let's look at it from the pet's perspective. Let's look at training our pets from the time they're puppies and kittens with high value treats, right? What can't they resist? What food are they going to come for? What treat are they going to come for? Every single time it's a fail-safe, you know they're going to come for that. We're actually talking about in our hospital, actually making designated pill bottles with a special giant label on them that are going to be medication trainers. And we're going to bring them in for puppies and kittens on their first visit, pick their high value treat from the exam that day, put them in there, shake the pill bottle, fake pills, and train them to come when a pill bottle is shaken so they can get their high value treat. Do you think that'll change things when Roscoe's 16 or Grace is 16 and we need to get medicine in them? Of course it will. Why didn't we think of this sooner? Safe space. We know from Fear Free, safe spaces are important. But what if we taught every owner that that safe space, just like all of us had on the couch with the blanket and the fireplace and the warm soup, what if every animal had a safe space in their house where good things happened, where positive reinforcement occurred, where they were shown how much they were loved and valued and cared for? And what if we associate that space with high value treats? How will that move the scale for an animal? There's the 3 meatball method, right? This is where you line up that high value treat. Quite frankly, maybe it is a meatball or a little cheese ball. And the first one is plain. The second one is laced with the medicine. And the third one is plain. And maybe you make it a game and you line up on the kitchen counter once a week, maybe Sunday's treat day, and you line those 3 meatballs up and teach a dog or a cat for that matter to take 3 meatballs in a row. And then social pressure. I gave you that example with the client who learned to give the chewy, tasty joint supplements with social pressure from the healthy dog getting the sick dog to take it. By all means, if we can do that in the exam room, use that to your advantage. And then what if we train the owner? What if we train the owner the value of the treat ladder? And what if we got owners to install at the back door where the leash hangs a treat ladder? It's not rocket science, right? And let the animal choose treats and give a variety of treats. What if we set up treat ladders for cats, and maybe cats on Sundays or Tuesdays after work, you come home and instead of putting out the little churro paste and just doing salmon flavored, maybe you do salmon and chicken and beef and tuna. And maybe salmon is their favorite, but maybe they learn to appreciate the variety, because when the little dab of one is gone, they can go to the next one. And now we've trained them to not be finicky. Could that work over a lifetime of a pet? Absolutely. What if we gave owners informed options? What if they knew from the time they came in with a puppy and kitten that we have other things other than pills that might not taste good? What if they knew medicines could come as a liquid or a flavored chew or a quick dissolve tablet? Maybe they could help us make informed decisions on the best way to treat their pet. Maybe they could learn to then advocate for their pet. What might be the best thing based on their scenario and their training with their animal. And if they worked on desensitizing their animals to touch. And then the veterinary team. What if we worked a little harder in our offices with client education? What if we, and I think after doing this talk tonight, I think I've convinced my team, we're going to start with Facebook releases and call it Medication Mondays. And we're going to give owners little tips on Mondays about how to safely, humanely, proactively work on medication strategies for their pets before the day that they actually need medication. What if we became an advocate and leveraged in practice learning and passed that along to our clients? What if we took the EMRs that Fear Free has made us so good about putting in our records, instead of just discussing it in the office, what if we discussed the EMR and the implications of that with an owner? And let me give you another great example. I know you're going to think these things are made up, but this actually happened last week with a little doodle, right? So everyone got a doodle. It's an apricot doodle, in case you wonder. It's an apricot doodle that they got during COVID. So last year, she had her 1-year checkup, and we put a good EMR in. She refused cheese. She liked getting scritches behind her ear and petting and loving her. And that's what actually made her happiest when we did her vaccines. So before the visit, year 2, we're going in to do our vaccinations. The technician and I briefed. We know she doesn't like cheese, so we're going to try some other things. And she likes scritching behind her ears. We're going to work on that and see how that goes this year. We're trying our darndest. We're petting the ears. We got the owner petting the ears. This dog will not stand still for anything. She's climbing up the owner. She's jumping into the owner's arms and the shoulder. The owner looks at the counter and she says, "Excuse me, doctor, why aren't we using the squeezed cheese?" I said, "Well, that's easy. The EMR from last year, we noted that she doesn't like squeezed cheese." And the owner said, "But you didn't ask me, doctor. I saw you use squeezed cheese last year and I saw she didn't like it. And I saw you wanted to put that on her kennel cough vaccine so she could get that easily. So we spent the last year practicing with squeezed cheese." Talk to your owners, engage them in the EMR, pass that information along, show them how they can be an advocate for that pet. Because I'll tell you what, guys, we pulled the squeezed cheese out. That dog rocked her visit, stood for vaccines, all but handed me her leg for her blood draw for her 40X test. We had an awesome visit. Share that EMR with the owners. They want to be involved with their pets and know that information. Become compounding ninjas. If it means getting on the first name basis with your compounding pharmacist, so be it. But look to them for options. Know yourselves where to look for options that are out there. And then when you get to the end of your rope, and not just with Tilly, not just with your number one client and their number one pet, go to it as your default for all of your pets. If you could make medicine fun for everybody, wouldn't that be a win for everybody? And cooperative care. We know this from Fear Free, right? And our zoo veterinarians, they're like the hallmark for cooperative care. I challenge each of us, if they can teach a tiger to hand a paw out, to get a blood draw in reward, all right, maybe it's a giant T-bone, but to do it for anything, we can certainly teach a dog that, or a cat that, or even an owner that, right? And so if we take this knowledge, if we take all these strategies we put together and we educate clients with Medication Mondays, and we do trainer bottles to train owners to have an animal come for, pill time when we shake the bottle, what a better world will be when these animals get to be 10 and 16 years old. And what if we're able to take and use our fear-free knowledge from our fear-free professionals, and if they can take the pet out of petrified, what if we can help them add the treat back into treatments and get some successful outcomes and celebrate some victories? So let's look at this equation, right? We've worked on this tonight. Now the pet's perspective. Oh my goodness, it's treat time. I'm getting medicine, but I don't know it. I just know it as treats when they shake that medicine bottle. I'm getting the good stuff. As a pet, I feel excited about getting medicine, and I have a good medicating experience. If I'm the owner, it's time for meds. I mean treats, because my veterinarian taught me a better way. And I can't believe they like this. Remember the client from the first picture, right? I can't believe they like this. That's a good attitude. Now an owner feels excited because he took part in getting the best medication option for his pet, and they've got a good medicating experience. And then how about us as the veterinary team? We know we have a successful medication plan created for that individual animal and their unique situation and their owner's unique situation. I know the owner's going to do this because they're bought in. I know the animal's going to do this because we train them to do this. So now whether the diagnosis is heart disease or joint disease or a skin infection, I know we're going to have a good medicating experience because I know we train them for the lifetime to get to this end goal. And so with that, I hope you guys are excited as I am. I think we have a lot of room to move the bar on medicating pets. I think if we could look 10 years into the future, we're going to see a very different world where this is actually not an issue and we wonder how we got here, just like we did with Fear Free. But now I want to open it up to questions for you guys and see how well we can help you in this journey.
Thank you so much, Dr. Minninger, for that great presentation. We truly appreciate it. And I know for myself, learned some great tips on how to improve in medicating my personal pets. I'm going to go through just a couple of questions that we received in the Q&A, if that's okay with you. With the first one being is if we have any tricks for eye drops when using eye drops.
So that's a great idea, right? So we all know the trick with eye drops is to sort of reach behind their head so they don't see it coming in front of them. We actually are fairly successful, again, with cheese or peanut butter, something they can lick, or a cat, like the little churro paste that they can lick, and put that in front of their nose and get them licking, and then put a quick drop in their eye. Again, if they're licking at whatever their high value reward is, prior to the drop, put the drop in and allow them to keep licking. And again, we can train animals for this, right? We could even potentially consider sending home a syringe with an owner so they could pull a little churro paste up and an animal could take it right from the syringe. But anything like that, that we're engaging them in something that tastes good. Again, eye drops will also sometimes put a bad taste in your mouth. So if you're putting a pleasant taste in at the time and training them, and you can train it by holding the stick up, right? Hold the treat up so that the animal's already in that position to receive the eye drops easily.
Perfect. Great tips. And I think this one could probably be answered by both you, Dr. Minninger and Dina, if you want to join in on this question. It is talking about how can we address the fact that most of these formulations don't have peer efficacy studies? And I know we briefly talked a little bit about that prior to the call. So if you wanted to chime in on that, that'd be awesome.
Absolutely. So while compounds will never have efficacy studies just because of the nature of compounds and the fact that we are personalizing it to be pet friendly and increase compliance, what we're really looking for is clinical outcomes, right? So really we're looking for how that patient responds to the compound and medication. And Dr. Sharon, do you have any,
Yeah.
experience with pemobendin
Right.
in particular?
And so what I would say is Dina's absolutely correct. However, and so we might have the official efficacy studies, but I guarantee you getting more of something in is better than getting nothing of something in, right? And you're always going to rely on your recheck exam and your follow-up and your blood monitoring levels and all of those kinds of things. So we've got tools to know that the medication is working. I can tell you, I don't know of a situation, and we've been using compounded medications for years. I can't think of a situation where I haven't had good efficacy, and quite frankly, even better than what I've seen in just dispensing, whatever generic capsule or pill that's bitter of whatever it is you're trying to get in an animal. I think that the benefit of compliance and owner compliance and getting the medicine in is what helps us to have a successful outcome. But don't, do your due diligence. Make sure you're following up with an animal and don't assume that it's working, because we know what happens when we do that.
Perfect. Thank you so much, both. Next one would be, what's your opinion about using gelatin capsules to administer medications, more specifically inclined towards feline patients?
So again, if you can get the animal to take a gelatin capsule, that's great. There are a lot of medications that can be compounded into that form. And, again, with training, I think we could actually train animals to do this. So we know that we can train a dog to come for a pill. Quite frankly, we had a cat in tonight. In fact, the cat I told you guys about with the jaw tumor that was in tonight, we actually sent that cat home on compounded gabapentin to eat in a pill pocket. The cat loved pill pockets right out of the gate. So again, if we can do that and then use another tool like a food product or a treat product to mask it, I think that's a good avenue. I do worry about cats if they're not drinking immediately afterwards, potential for that to get stuck in the esophagus. But it is an option, especially if we have something bitter.
Perfect. Next one would be, Dina, I think this one would be to you, is what meds do you know of that could be compounded into a transdermal pen at Roadrunner?
Absolutely. We have a ton of medications that are available to be compounded into a transdermal. The beauty about using a veterinary exclusive pharmacy is that we have veterinary exclusive pharmacists. So they are there to actually consult with the veterinarian and make sure that we're coming up with the right solution for that pet. And they can go over all the options, whether it's a transdermal that comes in your typical syringe, or the one Dr. Minninger talked about, the click dose pen that makes it easier for pet owners to administer and decrease, any overdosing or underdosing errors that are common.
Thank you so much for taking time to be with us this afternoon. I want to send a special thank you out to Dr. Sharon Minninger and to Dina over at Covetrus for sponsoring this great webinar, and I hope everyone has a great evening.